welcome to this second special edition of the Helplink Show. On this episode, we are going to be talking with Glyn Jones and Kevin Hogan, who are both addiction counsellors with Helplink Mental Health. They provide addiction counselling nationwide online and also face-to-face in Galway and Mayo, and hopefully soon in Roscommon. So they have also been providing our newest counselling service beyond the COVID-19 counselling service that we're providing, which is a gambling problem or gambling addiction counselling service. This service is available 7 days a week and out of hours with Glyn and Kevin, and they provide basically free addiction counselling services to anybody 16 years and over. And that's with thanks to the Gambling Awareness Trust, our funding partners for that service. So just to let you know, with regards to this episode, it was recorded a few days ago. So it was recorded before the new sanctions were put in place and for the new lockdown measures. And so some elements of it that we talk about, for example, going for exercise and that kind of stuff, may not be as correct as it was a few days ago. But as you know yourselves, this is a changing times that we're living in, so please bear with us. Also, they mention within it that we have the free gambling counselling service. Well, we've expanded that service during the COVID-19 crisis to provide free addiction counselling for those with addictions or problems with, yes, gambling, but also with alcohol and or drugs. So basically we're trying to support you guys as much as possible during this time. And those services are also available for loved ones and family members that are also being affected by the person's addictions in their lives. So that's about it. We're pretty much going to go straight into it, where we will have Glyn taking us through some information around COVID-19 and addiction centres, and then we'll talk about different supports that are available for people in their own home. They can do themselves and also online. And one last thing, we're hoping that you would go to our social media platforms on Twitter, Facebook, Instagram, and LinkedIn, and also then on our website, because we have a couple of donation campaigns going there to help us keep providing these free services we're providing during the COVID-19 crisis. Currently, we are providing free counselling for anybody that has been laid off work because of the crisis. We're providing free counselling to people who have addictions. You'll learn a little bit more about that later on, which is addictions to gambling, alcohol and or drugs. We're providing free counselling online also to those people who are returning to Ireland, and especially those healthcare workers that are returning to Ireland to help us out with this current crisis, and we thank them very much for doing so. And we're also still providing our Irish Abroad counselling service, which is free, and this is actually even more important now because we have a lot, unfortunately, of our fellow citizens that are stuck abroad at the minute and can't get home, so we're supporting them as well. So if you can, €5, €10, anything you can give to us will really help with us providing these free services to all our people, nationally and internationally. Thanks very much, and here we go straight into it. So, Glyn, tell us, you've been working on a document that will help some people just have a little bit of information around COVID-19 and kind of what's available for them out there. We might just have if you want to have a talk about that, and then we'll have a couple of questions back and forth and see how we go with this.
Yeah, absolutely, no worries. So by now, most people are aware of the coronavirus or COVID-19 and is sort of wreaking havoc on the public health systems on a global scale. and specific populations. They face unique challenges, and over our experience as addiction counsellors, a substance use disorder or SUD, among whom around about 10% access treatment, and depending on the severity of their disease and access to either economic or social supports. Many people with SUD, they're in and out of the A&Es or the addiction treatment centres, homeless shelters and prisons. And individuals with SUDs are more likely to experience either homelessness or incarceration than those in the general population. We look as addiction is a chronic medical disease of the brain. It's not a sign of moral weakness or failure. So some treatment centres or transition houses or halfway houses, as some people like to call them, hostels, unfortunately operate without sufficient medical staff or the level of doctors' involvement. And I will highlight a few potential impacts of the COVID-19 on individuals with SUD, for example, drug, alcohol or gambling addiction, as well as the impact on the treatment facilities. And hopefully this will reach many facilities or many people that are suffering with addiction, about what more needs to happen and how these rapidly evolving global health events are impacting on the vulnerable clients. So addiction treatment happens at various stages. So most SUD treatment occurs maybe at an outpatient settings. That is, people with an SUD, they go to work, go to school, take medications if needed, or attend individual or group therapy and then go back home. And many others, however, receive treatment at different clinical settings, which may include hospitals, inpatient detox or rehab facilities, opiate treatment programs, or OTPs, or they were previously known as the methadone maintenance programs, and of course the residential treatment facilities. And the vulnerable clients are being transported to and from various programs and facilities, such as detox, rehab, jail, sober living, residential programs and step-down programs. And other facilities frequently host large group gatherings such as Alcoholics Anonymous, AA, Narcotics Anonymous, the NA, and Gamblers Anonymous, GA. And all of these activities are associated with a great deal of close interaction with sick individuals, and not exactly the social distancing model that the public health officials are advising. And I suppose specific considerations for people with substance use disorders. Many individuals with SUD have a chronic illness, such as heart, kidney, or liver disease, which are risk factors for the developing COVID-19 infection. And depending on their socioeconomic situations, many people with addiction receive poor access to high quality healthcare, which means fewer vaccinations, fewer medications to treat acute and chronic issues, and unresolved and or worsening health issues. COVID-19, as most people know by now, attacks the lungs and causes respiratory symptoms. This virus can seriously impact people who smoke tobacco or marijuana, or of course vape as well. In addition, individuals with opioid use disorder or OUD and methamphetamine use disorders are vulnerable to lung injury, including respiratory failure and of course death. And substances such as tobacco, cannabis and crack cocaine reduce lung function and increase susceptibility to respiratory infections. Other risk factors for coronavirus-related infection among people with SUD, as mentioned before, include decreased access to healthcare, unstable housing, and increased risk of arrest and jail. And if our hospitals and clinics are at capacity, then clients with addiction who are already undeserved and stigmatized will face additional barriers to treatment for COVID-19. Social distancing, the primary preventative measure advised by the HSE, poses unique problems for people experiencing SUD and attempting to achieve or maintain long-term recovery. A common saying in the fellowship is that the opposite of addiction isn't sobriety, it's connection. This is especially challenging time for people with SUD, since an important part of recovery is the social support. And what needs to happen? Screen before arrival, before they come to any clinic, say, ask the clients about symptoms, fever, cough, shortness of breath, exposures and recent travel. Advise clients to stay at home. We need to get the high-risk clients out of the waiting rooms and other crowded areas. We have to do whatever it takes to take care of clients, but also to keep everybody else safe. Waiting room precautions, post signs about the hand hygiene and cough etiquette, advise people to sit 6 feet apart, mask and isolate sick clients in private rooms if possible. Ensure and expand access to medications. This is particularly relevant to clients that require or come in daily to receive medications. Allow take-home medications like they are doing now in Portugal. We're releasing medication to the clients and decreasing pickup schedules for people who have risk factors for complications. And revamp group therapy models. The behavioural therapies are a key component to a client's treatment plan and long-term recovery. At residential treatment centres, people often involve congregating small spaces. Therapy counselling would need to switch to more individual sessions. Intensive outpatient programs and AA and NA and GA will also need to implement the social distancing measures. Everybody needs to adapt to this pandemic. Also one-to-ones, if they can be carried out online to support vulnerable individuals through this tough time.
Yeah, it's there's a lot in there, Glyn, and there's so many different aspects that we just don't think of when. Well, I suppose it's very hard to think of something like this when it has never happened before. But yeah, it's a very, very complicated situation for a lot of people, especially people with addictions and mental health issues. I wonder. Are there things that we can say to people that currently have addictions, no matter what they are, that they can do within their own homes? Like, for example, I mean, does setting up a routine, like getting up in the morning and getting yourself dressed and brushing your teeth and all that kind of stuff, and like maybe detailing out a calendar of your week and days, is that something that can help?
Yeah. We often say in recovery is have your plan, plan to fail, fail to plan, but have your day set up, even do up a plan the night before, have your day set up, like you say, getting up, if it's going for a walk, taking the dog for a walk, or I know a lot of the gyms are closed now, so that's sort of narrows a lot of activities that a lot of people can do. But just to stay safe, there is now online supports. A lot of say if people came through treatment centres, there is online supports now. A lot of the residential treatment centres are showing their support now, where they would have their aftercare and maybe set up WhatsApp groups. That's something that seems to be coming to the fore now, that individuals setting up WhatsApp groups and then supporting each other, because part of recovery is the social support. Individuals, they have their sponsors within the fellowship, talk to them, but it is important that they keep absolutely active.
Yes, and there's I suppose you mentioned a couple of tools there like WhatsApp. There's also then Skype and Zoom that are being used for kind of group sessions, whether it's with the videos on or not. They're still being used now. I know that organizations like GA and also Grow, the health organizations, are holding their groups online now. Kevin, the second part of my question really for you two guys is a little bit touching on what Glyn said there, but social connectedness, very, very important at this time.
Absolutely, Lachlan, and people hear the word recovery capital mentioned quite a lot. And one of the biggest parts of recovery capital is that social inclusion, where I don't feel excluded, perhaps like I did when I was in full-blown addiction. And this is why it's so important. If people when they have attended their fellowship groups or recovery groups, whichever you'd like to call it, it's really important that they're encouraged to exchange telephone numbers for various reasons. We're going on a journey into the unknown here with this disease, unfortunately. Hopefully it won't be as bad as predicted, but the potential is there, and we don't know. But it doesn't mean that the recovery journey has to finish. It doesn't mean that it's stopped or it's on hold or anything else. We can still do the same things. Glyn said about connecting. Connect with people, even if it's only one, and you can have a daily chat to. It might be your sponsor. You know, Helplink have all. You know, we're on the end of a phone. You know, people, what they have to do is ring into the number. If it's around gambling, you know, I had a client yesterday, Lachlan, which was so interesting for me, but a gambling client through Helplink, one of the clients, and he'd never heard of the Gamma, the app to stop accessing sites and everything else, and he's used it for a week, and he said the peace of mind it has given him is unbelievable. So we have to add.
So sorry, what is that? What is that app you're talking about?
It's the Gamam app, and as I said, all they have to do is ring into Helplink, and administration there will be able to give it to them free of charge, and they just download it. It's free, and it stops any internet access for them to bookmakers and associated sites.
Actually, also on the website, if you can't get through on the phone, on the website, in the addiction gambling page there is a further page that will bring you on to useful apps and documents and that kind of thing, everybody. So thanks, Kevin, for that. So keeping connected and keeping physically well as well is also part of it. I mean, we're lucky enough now in this situation that we're not in the Italian situation where we can still go outside. So if where possible, I presume it's also a very good thing to get some fresh air, get some exercise if you can. And that in itself can help a lot, yeah.
Well, routine is so important in recovery, and especially in early recovery. Yeah, it's so important in early recovery that people have a routine and a plan, because what happens is if you keep occupied, even as Glyn said earlier, walking the dog or going out for a walk, and as you said as well, we haven't got a restriction on being able to go outside. But you know, for our own peace of mind, for our mental health, to get away from situations, just to be able to get a bit of peace of mind ourselves, and to keep a routine. And if we have a routine, even meditation is fantastic for people to try. YouTube has thousands and thousands of different meditation, guided meditation programs, which are very simple, and they're a great help because it clears the mind, stops the thoughts of the addiction.
Yeah, exactly. Are there any other home hints that you might have, Kevin, for taking care of yourself during this time, if you have a problem or issue with addiction?
Absolutely. I mean, focus on each minute rather than each day or tomorrow or everything else. Keep everything as in the now if you can. For anybody with a problem, but you know, it's really important. And as I said before about advocating, you know, we're an agency, Helplink. We're there at the end of a phone. You know, we're there. Let's just talk about gambling. If you have a problem with gambling, pick the phone up and ring. Glyn and myself, you can make appointments to talk online to us. We can talk by phone. We can do whatever, and we will be able to direct you.
Yeah. Exactly. I mean, we're very lucky to have the Gambling Awareness Trust funding that free service for everybody out there. So from a gambling aspect, we're there completely free for people 7 days a week. The issue, I presume that, Glyn, I presume that this problem with all the pubs being closed and off licenses, etc., like that, some of them are being closed and that kind of thing. I presume this is causing a lot of anxiety for people with alcohol issues.
I know some of the off licenses are restricting the amounts that you can buy from them, so that may cause sort of anxiety with some people, you know, with alcohol addiction, say. So it's, you know, it's about communication. Like, reiterate, if you're struggling, pick the phone up. Talk to your loved ones. You know, if you're in early recovery, you know, talk to your loved ones. You know, and tell them, be honest. It's an honest program. Absolutely, be honest and say you're struggling, and then at least you know, a problem shared is a problem halved. But there is going to be. There's going to be people at home living alone that are in addiction, you know, that don't have the access to the services and everything else. And who knows what that brings down the line, you know. There isn't people going out and checking up on them like they used to be, like project workers, social workers, you know. So how can we combat that? You know, that's food for thought.
I mean, so it is food for thought. Once again, if people go to our Facebook and our Twitter pages, there's a post in there, a couple of posts down, but some useful numbers in there for people that are struggling. There's the Alone number, there's Pieta House, there's Samaritans. There's quite a few numbers in there that hopefully people can help if they are in crisis. And for a more a longer and more sustained efforts to deal with the addictions, they can get in contact with us and get counselling with us 7 days a week for that. Glyn, Kevin, each of you, would you have one more point or one more tip or suggestion for people that are at home at this time?
Yeah, well, I would strongly suggest to people in early recovery that might have been to a treatment centre, that might have gone just to fellowship meetings, remember the principles. And one thing that has always, I'm in recovery over 20 years, and one thing that has always stood to me is the 3 A's, and that's acceptance, attentiveness, and awareness. Right. And I'll give you a quick example of this, Lachlan. Yeah. If I'm walking down the high street, just for argument's sake, and I go past one of the pubs that I used to drink in, and there's 3 or 4 guys that I used to drink with, and they're stood outside the pub having a cigarette, I can feel a bit apprehensive and anxious. I don't want to upset them. I don't want to do anything. I accept I have a problem. I accept it's a dangerous situation. So I'm aware of it. I'm aware that this is a dangerous situation, and now I need to be attentive. So I walk by them and, come on in, Kevin, for a drink. Lads, I'm terribly sorry. I have an appointment. I'd love to see you. I'll see you again. And I walk on. And I've operated the 3 A's, and it's got me out of trouble. And if people use them 3 A's, that's a great tool. And also, go on to your GA website, go on to your AA website, go on to Narcotics Anonymous website, and they direct you to different platforms. It's all there. As I said, it's all there. As you said earlier, and I've said, and Glyn said, we're at the end of a phone help link. We're there to help people.
Yeah, exactly. Glyn, actually, I just had something when Kevin was saying that about GA, and there's also the situation for people, the loved ones of people who have addictions, and they're at home with them right now, and they're struggling with this as well. What would you say about that?
Yeah, there is support for the families, and it's critical for them that they have the support as well. There's Al-Anon for people living with somebody in addiction or living with somebody in recovery from alcohol addiction. There's Na-Anon, which is the narcotics one, and then there's Gam-Anon, which is for the gamblers, families of the gamblers then. But it's also looking at rural Ireland. I think that's, we all seem to talk about the cities and everything else, but rural Ireland needs the support as well, you know. So if there's anybody out there, like Kevin was talking about, the communication, always have a plan is a key one as well. And that is a very, very important one, you know. Always have a plan, stay going, keep going. But communication is key. So if you know of somebody, if you're in rural Ireland, or if you know of somebody that is struggling, you know, pick the phone up to them, or even, you know, get some word to them, you know, to see that they're all right, and check in on them, you know, keeping that social distancing and everything else, but just check in on the vulnerable people out in rural Ireland. I think that's key, you know.
Okay, great. Okay, gents, thank you so much for all your wisdom there, and we very much appreciate it. I'm sure the listeners do too. Once again, everybody, this has been the Helplink Show. We are still open and providing counselling services to you. Basically, We are providing general solution-focused counselling, youth counselling, addiction counselling, as we mentioned there, and the gambling addiction portion of that is for free. The others are from low cost. We also are doing bereavement counselling, couples counselling. So a lot of things there for you. If you would like some tips and interesting to listen to interesting things that are going on, check out our social media channels, our YouTube channel, etc. We're going to be doing lots of bits of stuff over the coming weeks and days and months. Kevin and Glenn, thank you so much, and we will be talking to you on the next segment, everybody. Thanks very much.